Hi everyone, my name is Jyoti. Today we are going to discuss about a topic called cancer. Cancer is today's topic. What is cancer means? Cancer is a dreadful disease. It is a most dreadful disease which kills millions of people. It is the most dreadful disease which kills millions of people all over the world. Next, what is the difference between normal cells and cancerous cells? Means normal cells are having some properties called number 1, normal cells shows controlled cell growth as well as cell differentiation. These are the features. First one is the normal cells which shows controlled cell growth as well as cell differentiation. Second one, they have an important property called contact inhibition property. Meaning of contact inhibition property is whenever the new cells gets attached to the existing cells, it will stop the cell division. Cells gets touch with other cells and causes stopping of cell growth. This is an important property for the normal cells so that it can avoid. This property helps in it avoids the abnormal cell growth. So these two are the main one. In the case of normal cells, these cells are showing a proper cell growth as well as cell differentiation, and they will show a contact inhibition property. Next, this is cancerous cells. Cancerous cells are showing unproliferated. It is showing a abnormal cell division. This cancer cells breaks the cell regulation. And next important property is these cancer cells lost contact inhibition property also. Normal cells are following contact inhibition, but these cells lost the contact inhibition property. These cancer cells, they grows rapidly. They will grow rapidly, and the next one, even they will invade the other parts of the body also. They can grow rapidly. Why do they are growing rapidly? Means because of absence of contact inhibition property, and they starts to invade the other parts of the body, and even it will damages the other parts. Not only this, even it makes the starve. They starves the normal cells. How do they are starving the normal cells? Means by competing the nutrients. By competing the nutrients here. So because of all these properties, they will undergo uncontrolled cell division. It leads to uncontrolled division. So this is the main difference between normal cell and cancer cells. Next. Then the definition of these cells are the mass of proliferation of cells actively is called tumors. Yes, the mass of proliferation of cells actively is known as tumors. Next, there are two types of tumors are there. One is benign tumor and second one is malignant tumor. This is benign tumor and this is malignant tumor. What is the difference between these tumors are? First one is benign tumor. This benign tumor starts uncontrolled cell division. Already they lost the contact inhibition property and they start the uncontrolled division. But these cells confined to one organ only. They are confined to one organ or they will confined to at specific site only. It means wherever this proliferation has done, that these cells are present in that site only. That's what it is known as benign tumor. It means there is no spreading. In this case, we cannot see any spread. There is no spread to other organs. They are confined to specific one. Okay, does it cause any damage? Means here there is no damage. There is no damage, or we can say little damage. No damage or little damage to the tissue. So these are the features of benign tumors. So benign tumors means already the cell division has become uncontrolled because of breakdown of points, and it is confined to only one specific area, and they are not going to spread to any other regions, but there is little damage we can observe. Next one is malignant tumor. Malignant tumor means this is rapidly dividing cells. You can see more proliferation compared to before. Here we can see more proliferation, rapidly dividing cells. Next, this starts to invade. They starts to invade to other organs through blood. They start to migrate from one region to another region, even though that region may be nearby or it may be distant region also. It causes damage of the organ, or it causes damage to the tissue. And these migrated cells, the migrated tumor cells get lodged at distant sites. Once it gets lodged at distant sites of other organs, it starts a new tumor. This is known as secondary tumor. So this is the advanced case here. So these are the features of malignant tumor. Malignant tumor are rapidly dividing cells, and it is known as neoplastic cells. This is known as neoplastic cells, where these cells starts to invade the other organs through the blood, and next they will cause us the damage. In this picture they are showing damage also. It will shows damage, and these cells will start to migrate to other portions of the body, and they gets developed into a new tumor. So this property is known as metastasis. Metastasis. Metastasis meaning is the property of spreading of tumor to other regions of the body is known as metastasis, and this metastasis is most feared property. It is the most feared property of malignant tumor. So this metagenesis we can observe especially in the case of malignant tumor. Next, what are the causes of cancer? Generally the cells have inactive oncogenes. These inactive oncogenes we are calling as proto-oncogenes. Inactive oncogenes, or it is also known as cellular oncogenes. But these cellular oncogenes, they are present in inactive state. Each and every cell we are all having this inactive proto-oncogenes or cellular oncogenes. This is also known as C-onc. These inactive cells gets activated. It will become active oncogenes. Why do they are changing into oncogenes means it may be due to some conditions, due to some certain conditions, or it may be certain reasons, or even it may be certain conditions, or it may be some agents. Those agents are known as carcinogens. Carcinogens. What is the definition of carcinogen is? Carcinogens are the agents which induces cancerous growth. Which induces cancerous growth is called, it is called carcinogens. Whenever the inactive oncogenes gets activated, these active oncogene leads to tumors. It leads to tumor. It starts with benign tumor and it will be continued as malignant tumor. So there are three different types of carcinogens are there. One is physical carcinogen, that is physical agents, next chemical agents as well as biological agents. First one is physical. Physical agents. Physical agents are classified into two. One is ionizing radiation. These are ionizing radiations or non-ionizing radiations. Examples for ionizing radiations are X-rays as well as gamma rays. These two comes under ionizing radiations. Non-ionizing radiations are UV rays. They are UV rays. What is the role of these radiations? Whether it may be ionizing or non-ionizing, these radiations damages the DNA. It can damages or even it can induces mutations. It can damages or even it can induces mutations in the DNA. Whenever the DNA gets damaged or the mutations gets induced, it leads to cancer. So this is known as physical agent. Next, second one is chemical. Chemical agents means these are the carcinogens, they are of chemicals. Chemical agents are chemical carcinogens. Chemical carcinogens, for example, tobacco smoke. tobacco smoke. The tobacco smoke which induces lung cancer. It is a major cause. Next, for example, one more. If you take vinyl chloride, this vinyl chloride exposure leads to liver cancer. Next, mustard gas. Mustard gas exposure also leads to lung cancer. So all these things comes under chemical carcinogens. So physical carcinogen, next chemical carcinogen. Third one is biological. Biological carcinogens means here they are viruses. Biological agents. Biological agents are viruses. These viruses are known as oncoviruses. Oncoviruses. How do these oncoviruses will causes the cancer means these oncoviruses will introduce their oncogenes into the host so that the host will loses the regulation and it leads to cancer. So these are the agents or they are also known as carcinogens. Next, how to detect the cancer and as well as diagnosis here. First one, the cancer detection and diagnosis can be done by means of biopsy and histopathological studies. This is one detection method. Second one is blood and bone marrow. Blood and bone marrow test here. This blood and bone marrow test, it is used especially in leukemia. That is in the case of blood cancer. Next, third one. Third one is techniques. Techniques. The techniques called radiography, next CT scan and MRI. These are the techniques we are using for detection of cancer. Next, fourth one is immunodetection. Immunodetection means detection of cancer specific proteins by using some antibodies. It is known as immunodetection. Next, fifth one is molecular techniques, molecular biology techniques. By using molecular biology techniques also we can detect as well as we can diagnose the disease. Yeah. Biopsy as well as histopathological studies, this is used for tissues, whereas blood and bone marrow test is used especially for leukemia. And next, some techniques called radiography, CT scan as well as MRI. Next, immunodetection as well as molecular biology techniques. This technique is biopsy. This is biopsy. Biopsy technique means here collection of suspected tissue. Collection of suspected tissue from the region is known as biopsy. Collection of suspected tissue from the living organism or from the individual is known as biopsy. After collection of this suspected tissue, Next step is section cutting. We can make into thin slices. The tissue can be done into thin slices. These thin slices are stained properly. Next one is staining technique, and this staining technique is followed by it is observed under microscope. It is observed under microscope, and this is known as histopathological studies. Histopathological studies means here observing of cell under microscope is known as histopathological studies here. Suppose if the suspected tissue is having more number of dividing cells, if the suspected tissue is showing more amount of nucleus or more amount of DNA along with more number of dividing cells, means easily we can suspect that tissue as cancerous tissue. So this is biopsy followed by histopathological studies. Second one is here same, that a blood as well as bone marrow test. Blood and bone marrow test. Blood and bone marrow test means collection of blood samples from the patient or collection of bone marrow tissue from the patient, and we have to cell count. We have to count the number of cells present in the blood, or even we can detect the number of stem cells present in the bone marrow, and finally we can identify the cancer. It leads to cancer detection. But this type of thing we are using only for blood cancer, that is leukemia. Next one is techniques. Techniques are of three types here. That is radiography, this is CT scan as well as MRI. First one, radiography. In the radiography technique, we are using X-rays. It uses X-rays. And second one is CT. CT means computed tomography. Computed tomography. Even this computed tomography also uses X-rays. It also uses X-rays. In which of the following technique the X-rays are commonly used? Answer is radiography as well as CT. And the next third one is MRI. MRI full form is magnetic resonance imaging. In this technique, they uses strong magnetic field, along with non-ionizing radiations. Here. So overall three techniques here. One is radiography, which uses X-rays. Next CT, in this case also they are using X-rays, but in the case of MRI there is no X-rays. Instead of X-rays they are using some strong magnetic field as well as non-ionizing radiations. What is the use of these three techniques? Means these three techniques, it is used to detect cancers in internal organs. Internal organ cancer can be detected by means of these three techniques. Here. Next one. Difference between CT scan and MRI is, in the case of CT scan, they are using X-rays, and this CT scan, it is used to detect or to get 3D images, to get 3D images of internal organs. Here. So we need to get some 3D structure of the specific organ, or we can see the cancerous growth in 3D level means here, that time we'll go for CT. Next, the second one is MRI. MRI uses, they are not using this X-rays. Instead of X-rays, it is using magnetic field. Strong magnetic field as well as radiations they are using, which is not harmful, but X-rays are harmful, but in this case there is no harmful. And the use of this MRI is, MRI detect, it will detect pathological and physiological changes. This is important point of MRI. It detects the pathological and physiological changes in the living tissue. And even this MRI is non-harmful, but whereas CT in some cases it may be harmful, because during detection time the patient is exposed to X-rays, but in the case of MRI there is no problem. So this is the CT scan where you can get a internal organ, but benefit of MRI is here you can get pathological as well as physiological changes also easily you can observe. Next one is immunodetection. Immunodetection is also a type of advanced detection technique where the cancer is detected by using some antibodies. By using antibodies, immunodetection means it is regarding to antibodies. It is detected by using antibodies which are against to cancer specific antigens. And even this is an accurate method also here. So immunodetection means where the cancer can be detected by using some antibodies. These antibodies are said to be a monoclonal antibodies which are specifically created against the cancer specific antigens. Next one is molecular techniques. When do we are using this molecular biology techniques means, molecular biology techniques generally we are using to know about the history of their family. In some cases the cancer will be hereditary. So hereditary cancers we are detecting by using a special techniques called molecular biology techniques. In this molecular biology techniques we are identifying the mutated genes. Mutated genes are identified by using molecular biology techniques. So how do we are identifying the mutated genes by means of this technique means, in this technique we are using some probes. In the technique by using probes. Some radioactive probes we are using. And what are these probes means, these probes which are, these are actually radioactive probes. These radioactive probes we have created against to normal cells or normal genes. We have created for normal genes here. When these probes gets aligned to the genes, and you will get a band. When a person will get a band means here he is normal. When he doesn't get any band in the electrophoresis are followed by autoradiography, it means the person is cancer or his family is having a mutated genes. So these are the techniques commonly used for detection. Next one is treatment. There are different types of treatments are there. Radiotherapy, chemotherapy, immunotherapy as well as surgery. Surgery means already we know removal of the tumors from the body is known as surgery. Next one is chemotherapy. Chemotherapy means literally it is killing of cancerous cells. Killing of cancerous cells or inhibition of division in the cancerous cells by using drugs. By using drugs, those drugs are known as anti-cancerous drugs. So the killing of cancerous cells by using anti-cancerous drugs is known as chemotherapy. But here some side effects are there. Side effects of this therapy are generally the patient will become weak and he is facing the hair loss, as well as the person is suffering with anemia also. So these are the side effects to the patients where they are undergoing the chemotherapy. Next one is here radiation therapy. Radiation therapy or it is also known as radiotherapy. Radiotherapy. Radiotherapy is a special type of therapy where we are killing or where we are irradiating the cancerous cells by using some substances. For example, like cobalt 60 or iodine 131, etc. we are using to kill the cancerous cells. But during this time we have to take care of normal cells also. We have to take the So we have to expose the cancerous tissue with radiations as well as we have to protect the normal cells. Where are normal cells means here? These normal cells which are surrounding the tumors. So the first point is here irradiation leads to death of cancer cells, and as well as even we have to protect the normal cells which are surrounding the tumor. Next, third one is chemotherapy. Next one is immunotherapy. Chemotherapy, radiotherapy as well as immunotherapy. Immunotherapy means here treatment of cancer by using specific antibodies. By using a specific antibodies which can bind cancerous cells, which can binds the cancer cells, and finally it destroys tumor. So this immunotherapy, we can call it as it is a specific method. In this specific method, the treatment we are doing especially to the tumor only. So there is no problem to the normal cells here. And one more immunotherapy is, generally these cancer cells avoids the detection. It avoids the detection and damage because they are having some protective effect. They are going to avoid their detection as well as damage by immune system. For that reason, they are growing very fastly because they are escaping from our immune system. They are escaping from our immune system because of some detection, because of some hiding property. Because of that hiding property, they are easily escaping from our immune system and they starts to uncontrolled division. So this property we can avoid it by injecting some biological response modifiers. The patient has to take this biological response modifiers called alpha interferons. This is actually best method without any side effects. The patient will have very least side effects here comparative to the other methods. Alpha interferons, these interferons action is, they are not directly killing the cancer cells. They will activate the patient immune system. They will activate the patient immune system, then automatically the patient immune system destroys the cancerous cells. Cancerous cells here. So these are the different types of therapies are there. Radiotherapy, next chemotherapy, immunotherapy and surgery. But which is the most common approach means the most common approaches of cancer treatment are: number 1, surgery, number 2, radiation therapy, and number 3 is immunotherapy. When the question is which of the following are used as a most common approaches means the answer will be these 3: surgery, radiation therapy as well as immunotherapy. Suppose the question is most of the cancers, both are different questions here, most of the cancers are treated, most of the cancers are treated by which of the following techniques means that time the answer will be surgery, next radiotherapy or radiation therapy, but third one is different, that time we have to say chemotherapy. Common approaches means this is the combination, but most of the cancers are treated by means of which of the following means the answer combination will be surgery, radiotherapy as well as immunotherapy. That's all. Thank you.